Welcome to Joint Effort PAs, where two orthopedic surgery PAs get real about life in medicine. From tips and tricks to professional growth, work-life balance, and everything in between. We're here to share what we've learned and what we're still figuring out. Let's get into it. So we have a very special guest.
Yes.
Coming to hang out with us today. This is April.
Yeah, she is an orthopedic nurse practitioner. So thank you for joining us today.
I'm so happy to be here.
Yeah, so are we.
So
Amazing.
So we are going to dive into the difference between our mid-level providers.
Yeah.
So,
I feel like this is a good topic because maybe like people going into school or thinking between the two routes. I've had people reach out to me and ask me before, like, oh, should I go the NP route or PA route? And even myself, when I was thinking about going back to school, I was like, do I go the NP route? Like, does that make more sense from like an education timeline standpoint? So we're going to just like dive into all the differences and the pros and cons of everything and
how they're the same, how they're different. And we might end up at the end of this conversation, which one we like more or we might not. So April, tell us a little bit about yourself. How did you get into orthopedics?
I didn't choose it. It chose me.
Yes.
Yes. Good answer.
Yes.
I came out of nursing school really just thinking I was going to work in a doctor's office, which did not happen. I thought I would take the easy route, but typically that's not what I do.
Doctor's office, like, you mean family medicine clinic?
I was thinking like little primary care,
Okay.
just, getting vitals and stuff. But then I got offered a job at an allergy clinic.
Okay.
But then I went into the OR and I was like, oh my gosh, this is great. I saw blood everywhere. And I was like, I really love this. So then I told the allergy lady, I was like, I think I might get bored here. And she was like, that's wild. So
that was your RN or your RN life.
Yeah, that was my first job. I started off in the cardiac OR because I've always had a love for cardiac, but they had a mass exodus in orthopedics. There was a bonus involved.
Oh, yeah. Well, that usually does it.
Typical motivation. I scooted on over to orthopedic trauma. Loved it.
Yeah.
Loved it. It was just mass chaos. Spent a lot of time there. Then thought I wanted to go into anesthesia. So scooted on over. I did. I always like having extra jobs also. Yeah. So I was staying in the ortho and then I was working in the cardiothoracic ICU and learning all of that. Then it turned to COVID.
Yeah.
Mm-hmm.
Then I had my CRNA interview and was like, I don't think I can do this forever.
Yeah.
I feel like that's probably a bad time to like get into the CRNA.
Yes.
It was a turn off situation for it. But it's interesting because like you and I have talked about your like no interest almost in the OR now because it like burned you out from being there in a sense, or
well, I don't know that I know you guys' OR experience the way what I saw. I just saw. I would be a second scrub and I would scrub in sometimes, but it was just 12 hours of standing. And just that in and of itself, now that I'm old.
Oh my gosh.
Oh my gosh. Well, so you were in the OR as a RN. Mm-hmm. So what made you make the jump to nurse practitioner, and did you work throughout nurse practitioner school?
I did. That is the difference probably. Yeah. I was doing 412s. Like through clinical rotations and stuff. When I knew I wanted to keep going somehow in education. So after my CRNA interview, I was like, I got to do something different. I had several ICU friends that were doing nurse practitioner and they were like, you love these patients. I don't think you're going to like them intubated throughout your career. And I was like, you might be right. I have a thing for yapping. So...
So just to like quickly kind of draw a parallel between the two education wise. So PA school is, you get your bachelor's degree in whatever you want as long as you get your prerequisites. And it's depending on the program, a year to a year and a half or so of didactics. And it's literally like Monday through Friday, 8 to 5 classroom every single day. And then clinical rotations are a year to a year and a half, depending on the program. And you are it's as if you're working there, basically. Like you are there when the doc or PA you're rotating with is there. So again, like full-time job, basically. What is the NP route?
It's actually not too far off from that. The entire educational process is about 2.5 years. So, well, the master's, the NP program, or longer if you're doing PhD. But I got my nursing bachelor's. You get that first, and then you do about a year of just the classroom work, and then you do classroom and clinicals for about a year and a half.
So, like, how do people work during it? Like, is it self-guided that year of stuff? Like, are you physically going to a classroom?
No, after COVID, they've kind of made all programs all online now.
That's
Most of them.
crazy.
Yeah.
That's
UNC switched over.
Yeah. I get that, but that is crazy.
Because like PA schools haven't even they don't switch to that. Like,
no. Well, we did our first semester. My school was 3 semesters, so it was 4. Sorry, it was what would have been 2 years, so 4 semesters into 3. So it was, it was 3 semesters. So it was 1 calendar year, but however you divide 52 by 3, but that's what it was. So our first summer, we started like July 1st or something like that. It was our cadaver lab, pharmacology, clinical medicine, and then something else. So it was intense. Like 5 or 6 people dropped just from that because, I mean, the cadaver lab part of it was this whole thing. Did you guys do that? NP school? No? Okay. Interesting.
I wish.
So, but it was similar format in that it was clinicals and then, it was didactic then clinicals, but yours sounds like it was a little bit more, interesting. So, and the other really big difference in the didactic part of it is that nurses learn in the nursing model and PAs learn in the medical model.
Yeah.
So can you guys talk to that in any way?
As a nurse practitioner, I think there's a lot of great things about it, but I do wish I would have learned the medical model because it's just a lot of theory. I mean, I learned the anatomy and physiology and pharmacology and all of that, but there were several classes. I mean, every class had to incorporate Florence Nightingale in some way.
Ooh.
I mean, she's fantastic, but
of course she was.
Is that going to really help me today? Maybe.
So wait, what, I don't know. I don't know what that means, I guess. Like, what do you mean? What do you mean theory? Like, what does the nursing model mean?
The medical model focuses on diagnosis and treatment.
Yeah.
So it's more, pathophysiology of what diagnoses are and then how to treat them versus the nursing model is let's look at them as a whole. Their physical is one part of it, but then there's the emotional part of it, the social part of it, the spiritual part of it. So like nurse practitioners, I don't know how to say this.
I'm trying to not dig.
So there's more emphasis on the patient experience and how that goes versus, I feel like it's a little bit more cut and dry. It's like left brain, right brain. Is that like a good way to?
Yeah,
maybe?
Like I mean, I hesitate to say like holistic approach versus.
No, that's but it's more like I'm telling you have a rotator cuff tear and this is what we're going to do about it. Whereas. Nurse practitioners will say you have a rotator cuff tear. How does that make you feel?
Yeah.
Yeah.
Yes.
I mean, what does that do for your rotator cuff tear?
Or more so, how are you going to cope with that? Let's talk about all of those.
But that
things.
is important, right?
It is important. I think that what one has, the other one is lacking. And I think overall, when you don't discriminate between let's have just PA or nurse practitioner, you do get that good balance of needing to do all those things.
It would have been, I enjoyed the theory part. It's great, but I would have loved more of that.
Yeah.
Yeah. More skills, more learning.
In a managerial role, I think it is safe to say that I don't really have to guide our nurse practitioners on how to talk to patients. I know that sounds stupid, but PA students, there's a lot of PAs that will go undergrad right into PA school and don't have that life of like working a job and let me interact with the other humans in the world. Whereas I feel like nurse practitioners, they did that. They went, most of them are RNs to become NPs. So you have the patient interaction and that there's no learning curve there. So that I think is enjoyable, at least from my point of view.
Yeah. You come into it in an advantage there.
But the learning and the concrete things like in orthopedics, like the actual here's all the clinical diagnoses you're going to see. I feel like there's a little bit lacking there, but in a specialty like orthopedics, I don't think PAs have an edge there. I think orthopedics in general is not a massive part of PA teaching unless you seek it out. So I think when you have a new grad that is a nurse practitioner or a PA who maybe had an ortho rotation, maybe didn't, it's kind of neck and neck as far as their ortho experience. So.
Yeah. Because I feel like that is a common thing that I have heard. I don't know if we ever talked about that, or when I've talked to other nurse practitioners, they're like, I feel like I didn't learn any of this in school. I came so unprepared. Like my school didn't prepare me for this. I mean, like, I don't think neither Beth or I's program had a big emphasis on ortho. So in general, I don't think PA schools really do that either. Maybe some out there do. But do you feel like you got also little to none?
Yeah, little to none. I mean, I know my friends and myself came out just like, what now?
Yeah.
Like we don't actually know anything.
Yeah, no, that's a universal feeling.
Yeah.
Well, what clinical rotations did you have?
Well, I had primary care ones. There were a lot of it, so I enjoyed that. So I would do 2 to 3 12-hour shifts during the weekend of primary care, and then I would do my 3 shifts at work. So that was nice, being able to work my 4 12s, alternating with the 2s and 3s. But it was primary care. I mean, I don't know if it's like this in PA school too, but there's quite a racket out there with the oversaturation of nurse practitioners that my school and a lot of schools, you have to find your own clinical rotations. So some of them are a bit on the sketchy side. Just they can make money off the students. You're only supposed to have 1 or 2. There were places that were having like 8, 9 students.
So my clinical rotations were surgery, ER, OBGYN, peds, internal med, family med. And then I think I got 2 electives. What am I missing?
So ER
surgery.
pediatrics, OB, psych. Did you have psych? We had a 3-week OB, 3-week psych. It was split. General surgery,
yeah. But it was a lot of OR. At least in the beginning, mine was ER and surgery. Those were my first 2 rotations. So that felt like very like heavy in the beginning of like, here's the OR, let's do some procedures. And I was like, oh.
Yeah. Mine was
versus
inpatient.
I did internal med and family med, which I feel like those were the same. But my school was more trying to graduate providers that wanted to work in underserved like rural areas. So as the primary care provider, family medicine provider, which I didn't hate. I mean, I liked it. I just didn't like love it.
Interesting. Yeah. There's no surgical. There's no
crazy.
OR. Well, also family nurse practitioner, because there's different variants. I feel like you guys come out and you can do anything. But we have specialties, psych, geriatric, pediatric, OBGYN, and just family. So, I did a pediatric rotation, an internal medicine, a family medicine, and then 2 primary cares.
So if you want to be like, you're an FMP, so family nurse practitioner. So in order to get that degree, you had to do peds, you had to do all that. Let's say you just wanted to do geriatric nurse practitioner. So you can kind of guide your schooling to just do that?
Yep.
Okay.
And if you are like just OBGYN.
Yeah, totally separate.
Yeah.
Yeah. If you want to be surgical, then you have to get your first assist. So that's also totally
so that's a highlighted difference. That's news to me, right?
Huh. So, it's basically like, this is like buffet style. You're like picking and choosing what you're like building.
Hannah, do you want to be a nurse practitioner?
Interesting. So no, I thought about it for a while because like in my mind, like going back and having to take all my prerequisites for PA school, I was like, do I just like go get my, I guess, what's like the quickest way you can do it? Can you get like a BSN through a community college? Right. I'll go get.
Yeah, your ADN through a community college. You can get your BSN online.
Yeah, I'll just get my BSN. And then like that's another point to hit on, like application standpoint. Like from my experience, if you had the grades and you like had the stuff, like you were gonna get in. And PA school was like, it's a coin flip. Yeah. Like you can have all the right grades and you can be the perfect candidate and you can apply 4 times and not even get a single interview.
Yeah. I feel like it's very competitive for PA school. Not that it's not for nurse practitioner, but I don't feel like, again, like with your route, you were a nurse. Like that's, I don't know, is that a prerequisite for nurse practitioner? Like you have to have an RN or can you have an LPN or something like that?
No, you have to have the RN.
Yeah, but I feel like imagine going through those resumes. I mean, I feel like here's another nurse. Like, I mean, how do you know like which one's going to be a good nurse practitioner?
Yeah. So is that like, well, what is your experience applying to it? Did you feel like as long as I have the things, like I'm going to get into this program, it's not like stressful, like application process?
No. Not at all. No,
Wow.
I had all A's. I had my nursing experience, so
So you're like,
I
set.
applied and I
yeah.
was in. Yeah.
Yeah, that's
God.
awesome. So like, are there people who like that is not their experience, or do you pretty much feel like if they have
They're
the
good.
stuff lined up ready to go, you will be able to be a nurse practitioner?
Yeah, if you have the grades and you have the experience, you're in.
Hannah, what are we doing?
Yeah.
I don't know. I mean, like, well, it's too late now. I made my choices. Out of it, well, I did not want to work as a nurse. Just like, honestly, because then you have to work a little bit, right? I like just didn't see myself in that mindset.
Well, it's a
And
step to another step. You have
It
to work
is.
as a nurse, and then you have to apply to be a nurse
I-
practitioner. So it doesn't just like come out as
I never saw
that.
myself in that like personality type. And I think this like kind of speaks to what we were talking about, like the different models of things. I just don't think my mindset was, I mean, I'm not trying to say that like I'm not a nice, compassionate person, but like when I think about nurses, like, oh, they're like so sweet. Maybe that's just not
So
me.
Hannah wasn't sweet enough for nurse practitioner school.
yeah.
That's
I was
what
like,
that's
ugh.
what she's telling you.
Yeah.
I have not met an OR or ER nurse.
That's true. No, there's some people that I guess they give me a run for my money.
So wait, so if there was no OR for you, did you have any exposure to like, let's say right now, your job right now, you read x-rays every day. Like what was your exposure to x-rays or procedures? Like how did that, did you have any of that in school?
None in school, but that was my job. So I worked in the
true.
OR as my career for the most part, OR and ICU. I mean, I was always in the OR, even when I was in the ICU, except for some COVID times. But I was always exposed to their x-rays, but I was never sure what they were. So not that I was more focused on other things at the time, but I was exposed to x-rays. I just didn't know how to read them or anything.
So no like classroom instruction on that really either.
No, but I mean, we scrubbed in and I know how to scrub in just because of my job.
I mean, like, I feel like our education stuff it's not really that different when I think back
not,
to what I
yeah.
got. Like, I didn't have a radiology class. There was no test that was like, what do you see on this x-ray? And like, you're getting graded on that. It was like, you know, maybe here's an ortho lecture and here's a picture of a broken ankle, right? And like, it's a very obvious one probably.
Like super,
And then
ChatGPT
our
kind of lecture.
procedure experience was like, watch somebody inject a knee on a video kind of thing. Like,
Oh my God, you guys had, well, mine was not. We had like, we did injections like in the ER. Again, maybe it's the ER was my first rotation. It was like, we're doing all the things. You're suturing this, you're helping with
well,
that. Doing
rotations,
the PAP
yes.
things.
Rotations, yes. But like learning to do them in the school setting. No, there was no like, I don't think we weren't really,
so
weren't
you're-
injecting each other,
yes,
you know?
No. So when you were sent
Yeah.
out in the field, you were just
Yes.
as new as the next one.
Yeah,
Okay,
yeah. But like
fair.
in my ER rotation, like, yes, I was doing lac repairs and like PAPs and all the things.
Yeah.
Yeah.
Do you find in hiring between the two that one is more, that it comes easier to a PA versus MP with things like that?
Well, April, honestly, you're here today, so you can help me answer that question. So I reflectively don't necessarily think there's a difference in capability between a new grad PA and a new grad NP. I really don't. I think it has turned out, and again, maybe this is because I've written this book before, but I think it's the person. I think if you have a person who is willing to learn and has a good foundation, then they're going to do a lot better than someone who has all the skills that I want. Like, let's say I want to hire a PA and they have all the credentials, but they can't function with other people, or they can't function under stress, or they don't know how to ask for help or something like that. So I don't know. I don't think it's necessarily easier or harder. I've been burned by both professions. So we can talk about that if you want. But no, I've been burned by both. I had a PA that was so procedural heavy, like he couldn't do anything else. His blinders were on for everything. He just wanted to like do procedures and didn't care if there was 10 people over here, or didn't care that, you know, he wasn't using his time well, couldn't take feedback. And I had a nurse
Or that
practitioner.
he like wasn't doing the procedures correctly.
Yeah, wasn't doing the procedures correctly. But I had a nurse practitioner that left because her feelings were hurt by other staff members, which, again, not the topic of today's conversation, but I have feelings about that. Yeah. So no, her feelings were hurt. She didn't like that she wasn't respected necessarily in the environment by the surgeons, which again, we can talk about that. And then I had another nurse practitioner that just didn't like the chaos of the environment. And I don't know that that is specific to a nurse practitioner versus a PA. I think it was that person in general. But it's interesting how, unless, and I think what you're telling me is you had that exposure pre-NP school. So I think that has made you somewhat successful in what you're doing here. Yeah. So describe your job here. Like, what do you do in orthopedics?
I don't know.
What does your day-to-day look like?
It's very unpredictable. I think that's my favorite part. I'm walking in not knowing what's going to happen. I work in the urgent care, so people are coming in head to toe. I don't know what's going on.
Head to toe, I don't know. Did you plan that?
That's pretty good.
That was good.
So so let's talk about that
on the mug.
So for X-ray, so you're reading X-rays every day, right?
Yes.
Procedures. What type of procedures do you do every day?
I do love procedures, so whatever I can do, I will do. A lot of joint injections. Yeah. I mean, it's a lot of injections of any sort. I'm learning how to do ultrasound injections and
and that none of that. And again,
splinting
and Hannah, PA school versus NP school, like you weren't doing stuff. Let's say that you've learned on your job, right?
No, actually, ironically, like. I remember because you had taught me to use ultrasound for I'd watch you use ultrasound for injections before I even went to PA school. And during our MSK situation or like week of MSK, we brought out the ultrasounds and we would scan each other and then we would paint. Our program was like really big. Our program director really liked body painting. So we did a lot of body painting. It was fun, I guess. So we would just paint structures on each other. So like, the guys would just take their shirts off and we would scan and be like, all right, here's the cuff insertion.
I know. You guys are
and like you paint everything on them. I have like pictures on my phone of like I painted carpal tunnel on somebody. I've got a rotator cuff. Yeah. Somebody painted abs on me once. It was really nice.
Oh my God. Okay. Anywho,
shout out to Elon.
So, but the procedural stuff, it sounds like, again, not until you're out in your clinicals are you really getting your hands on. But in your current role, April, you do a lot of procedures. So would you say that you learned most of those on the job?
Oh, yeah. All of them. Yeah. I know a knee injection. I saw one and then was told to do it.
See when do and teach one, right?
That is pretty true.
I did it.
I feel like this is then just like a general universal experience. PA versus NP, like your preparation for the job depends on what you came from and like what your experience was prior.
But
for specific roles
beforehand, like the mentality of it is probably the biggest hurdle because as nurses, we learn to follow orders. So that can be a very difficult shift to get the order set. Okay. And you understand how to work within a protocol. I mean, even in the ICU, I had a lot of independence, but I was given a protocol where I could follow, this is what you do in these scenarios.
That's a good point.
So it's very, very difficult shift to, there's no protocol.
Do it yourself.
Yeah, like you just do something. Yeah. There's really no protocol.
Do you think either in school or currently in your job that you still seek that approval? Like you're always looking over to be like, is that okay?
Yeah.
Yeah.
Well, yeah, because there's still there's just so much to learn that I'm confident in trying my best, but if there's someone available, I'm like, ooh, it'd be good to know if this is.
But I think that's why, like, again, you knowing you as well or not well as I do, I think you have the personality type that's like, well, I really felt uncomfortable with that. I'm now going to seek out how to be comfortable with that. So I think, again, the supervision that you have currently allows you to do more stuff on your own, but it does require a personality that is willing to do that and also has, trust in themselves and then know your limits of know when to ask for help, that type of thing. Whereas I have had, and again, generalization, I have had in the past a little bit more trouble with PAs who think they know what they're doing because they have PA behind their name. And I'm like, bro, no, that's happened. That's happened before. Yeah.
Yeah. Yeah. That's tough. Any kind of confidence that,
Do you feel really like, because this is like a common PA thing that we've gone over before, but like, do you feel like you have a hard time explaining your role to patients, or patients like pretty much know and understand what a nurse practitioner is and like what you do and your role in the world?
Do they understand PAs?
No.
We are nurses.
Yeah.
Yeah. No, we're nurses. But Dan, who I work
with,
He's a doctor.
We're nurses because we're female. So I feel like explaining yourself to a patient, the default is when you say, I'm April, I'm the nurse practitioner, like, oh yeah, obviously.
That makes sense.
It
Yeah.
makes sense to me. Yeah. Whereas when we explain ourselves, it doesn't make sense to patients.
Yeah. They're like, so when are you going to medical school?
Yeah. When are you going to do this for real?
Yeah. Yeah. I like, people just don't understand. My step grandmother called me a couple weeks ago to wish me happy birthday and was like, oh, are you still being a PA? I was like, yeah, like that's my career. And she was like, oh, I just always thought you would like go to medical school now after, like,
but you know what I hate answering?
You gave up on that. And I was like, what? No, that was never my goal.
I hate answering though when they're like, oh, so when are you done? Like, when are you going to be done with this? And I was like, no, I'm done. I was done when I finished PA school. They're like, oh, I mean, you should have gone all the way.
Yeah.
And I'm like, oh, well, this was my way.
Yeah. Or like, good luck on the rest of your training. And you're like, you mean the rest of my day?
Yeah, exactly. Yeah. Okay. So when you are with, let's say, supervising physician or surgeons, do you think that they treat you any differently being a nurse practitioner when you're communicating with, let's say, an orthopedic surgeon? And more importantly, when you communicate with your fellow PAs, do they treat you any differently?
I don't think so.
Yeah, I don't think so either.
Having a career in the OR is very, very different maybe than when I was in the ICU. There was a vast divide between nurse and doctor, and the communication was very different. In the OR, it's very abrasive. So you learn to speak to one another on it's just a different level. So there's not really like a nurse-doctor divide. So, I mean, I feel like still when I talk to doctors, I don't mind calling them punks and whatnot because that's just
punks.
That's just what I do.
Yeah.
So I feel like I can relate to them on a person to person. I don't feel a big difference between. I don't know if that answers your question at all.
Yeah, I think so.
Yeah,
I think so. I don't think, at least in our culture at our orthopedic facility, I don't really think there's any difference when we communicate with each other. I think everybody's kind of on the even playing field. Yeah. I was just wondering if you thought that was, orthopedic surgeon, if you're not a PA, like what that thought is. And I think, again, I think it's individual specific, not necessarily like,
that individual's previous experience with one versus the other.
Yeah.
Right. But I mean, we've had I feel like a pretty even mix of both here. So,
yeah. And so you talked a little bit about the FMP geriatrics, like you just discussed various specialties that you can do with a nurse practitioner. So when let's say you graduated from nurse practitioner school, you had to take your boards, right? Mm-hmm. Okay. So for PA school, we take our boards. When I graduated PA school, we had to take our boards every 6 years. And I'm going into something like orthopedics that somewhat is a disadvantage when I have to take my boards on all medicine. So now it's every 10 years. Do you have to repeat your boards?
I don't think so.
You don't think so?
Oh my God. So we have to do our continuing education.
Yeah.
Like that's a requirement. But as long as you maintain that and your work hours, it's the same in the nursing world.
Beth, do you regret your life?
To the floor.
Do you regret your life?
Well, I regret it every 10 years when I have to study for the boards.
Wow.
But I think that is changing for us, right? I probably should know this. Are we behind the 8 ball on this? Because that was in the process of changing, right?
Well, so I took it already where instead of going into a testing facility to take your test, we now can, and I did this 10 years ago. I've taken my boards 3 times over because it was 6, and then I think this next one will be 10, I think. But no, I've taken it 3 times. This will be the 4th time. I passed each time. So.
You're still here. Yeah.
But the last time I took it, it was the pilot for over a year. You could take the boards and it was open book. And you only had one chance to take 25 questions. And it was 4 of those, I think. Yeah.
Okay.
So I would study on the go because I don't have time in my life to study. So I would study on the go and then sit down and take that quarter. And then I'd study again. You had 2 years to complete it. And I have to sign up now for that in 2029. I have to sign up now.
Last year you did that or?
Last go around. So it was 6.
Yeah.
6.
So they launched it. So I guess they had the traditional PANRE, which was like the 10-year recertification. Then there's the PANRE LA longitudinal assessment. So that must be the newest one. Yeah. Online exam, 8 to 12 quarters during a 3-year period. Yeah.
That's what I did.
Okay.
So I did two legit ones, 2 PANREs. I did one at 6 years, then one at 5 years because the doc I was working with had to do his recertification. We were going to do that together. Mm-hmm. So I took mine early and then I think, again, and now I'm in the 10-year thing.
Wow.
What?
That's
Do you guys find it odd at all that I think overall, I mean, it's probably a longer route to become a nurse practitioner, but I think it's the easier route.
what do you mean by,
Like-
by easier?
I know what she means.
Let me bring
Okay.
up a whole bunch of-
I want you to say it out
a
loud.
whole bunch of points. I got my associates, I got my bachelor's, I worked, I got my master's. I mean, I worked throughout the entire thing so I could still generate income while I was being educated. I never had to worry about getting accepted into the schedule or into the program. My program, another huge factor is cost. From what I understand, PAs have to pay about $200,000,
That is a fact.
and I had to pay 40.
I'm having palpitations right now.
I
It's a huge difference. And then I come out, I passed my boards, which was actually, I don't know. I hope I'm not sounding arrogant, but it was a lot easier than my NCLEX. You have to take an NCLEX once you get your nursing
And I've
license.
heard that's hard. Yeah.
That's hard. Getting my master's, or becoming a nurse practitioner, not hard. I walked out of there like, wow.
Yeah.
Wow. That was
From
easy.
the nurse practitioners that I've spoken with, it seems like a very stepwise thing. Like you follow the steps and you will get
you're
there.
done.
Whereas I feel like PA was like
So much harder.
the hardest part for me was getting in. And we'll have to do a whole segment on that in the application process because that like it only gets harder it is challenging and they make it very it's also just because it's so popular. Like there's such high demand. So many people are applying. There's limited spots for it. So, yeah.
Yeah. And I can open my own clinic in some states.
That is true.
It's very bizarre to me.
Yeah.
I don't know.
There's
Interesting.
the cost thing. I'm like,
You lost
dizzy.
Hannah about 5 minutes
yeah.
ago.
Like I'm dizzy thinking about my monthly student loan payments that I'm
But
making right now.
PAs can jump between specialties. Like I could decide tomorrow that I want to go to pediatrics. Spoiler alert, I don't. But I could, and then I could go into cardiothoracic, whatever, and then I still have to take my boards and be good at all the things. So a little bit more flexibility, it sounds like, with the specialty that you want to go into. But I think we're agreeing that in orthopedics, I don't think there's a huge difference. There's a different way of getting there for nurse practitioner versus PA. But I think if you find the right person who can handle the things in ortho world, I think either PA or NP is a pretty good choice.
Yeah. I agree.
Okay. So x-ray wise, we talked about ortho, very specific things. So x-ray wise, you said not a lot of exposure to x-ray as far as like, hey, this is what it is, this is how you read it. Okay. Hannah, PA school, x-ray exposure.
Just a couple pictures here and
Perfect.
there. Like here, this is what
placed,
this is what a wrist looks like. This is what a leg looks like. Yeah.
And then, so OR, again, April on her history of just work history. So that was, yes, good exposure. And then Hannah coming into it, just surgery rotation.
General surgery rotation, and then my electives, which were orthopedic surgery.
Yeah. And then, so procedures, injection, splinting, wound care.
On the job.
On the job. That's crazy.
Yeah.
So I don't necessarily think that either one of them prepare you for orthopedics.
No.
So what, okay.
Here we are.
Both of you, what makes you guys stay? Like, why do you like it?
Chaos.
The chaos.
Mhm.
We
I
talk
do
about
like
the
it.
chaos all the time and how much we love the chaos
Yeah.
Trauma.
of our
Yeah, trauma
coffee
response, yeah.
spilling
Yeah.
out of the cups
Oh,
as we
everywhere.
drive.
But do you
Yeah.
like the chaos in so much as I like the chaos because I get to treat people and get them back to doing physical things. Like there's something inside of me that really likes promoting this person leaving here and being better physically. Like I just don't know that I would
Yeah.
like the chaos of a strep throat clinic.
No.
Ew,
that
yeah.
just would-
Also, I
wouldn't
don't want
make
to
me
get
happy.
strep throat. Like,
Yeah, there's nothing we can get. Actually,
Yeah.
that's a very good
Yes.
point. There's
well, I
nothing
don't know.
we
You
can-
tore your AC.
Okay, that is true. We can- That's
can catch
true.
that.
We can catch that.
Yeah, you
Catch
caught that
That's
one.
contagious.
Yeah, no, it's like a personality thing, though. I feel like April, what did you ask both of us before this? And I think that is ultimately what this all comes down to. What is the personality for orthopedics?
Yes, I did ask. Would you both consider yourselves hyper independent females?
Yeah, hyper independent female.
Yeah, I don't like the word hyper independent. It's
Just
like
independent.
There's like very independent. I know you're saying the same thing, but hyper independent makes me feel like I have
Too
to like
much or
broadcast.
something.
It's
Yeah.
too much.
Yeah.
It's not too much though.
Yeah, no, it's the right amount of independence.
It is.
But I also feel like we are all active people. You just had
Yes.
leg day today, right?
Yes.
I couldn't have leg day today because I can't really feel my legs after my
Yeah,
run
I can't.
yesterday. Beth has rhabdo.
I have rhabdo. I've decided. So, I mean, I
She's
think
had rhabdo for 3 days now.
no, I need to go treat everyone else who has that in clinic when I see him tomorrow. Yeah.
Like, wait.
So I think we three are all probably cut from the same cloth. Therefore, we choose ortho where it shows us. I don't know, but I think we're really successful in what we do because our personalities fit the job. So their credentials are a little bit different, but I think in the end, it sounds like it's easier for your wallet to go to nurse practitioner school
And less stressful to apply to the programs and get in.
But I don't really regret it. I like my path.
Yeah.
So
I
far,
mean,
so good.
I wouldn't change anything about it.
Okay. I'm convinced.
My debt.
My debt, but
It's fine. It's fine. I knew what I was getting myself into. It's all good. No, but that was the right, path. Also, I feel like as an athletic trainer, right? Like if I had gone to nursing school before, of course, my path would have been NP as an athletic trainer before. And PA is like, just generally speaking, that is a pathway.
I think in family medicine, internal medicine, it would benefit you. Like if you went to NP school, I feel like it's a very good path where I feel like right now, and I'll tell this to med students, like med students who are going to medical school to go into primary care, I feel like, I mean, I think the way that like 2025 is and the way AI is, I really just think that MDs and DOs in primary care, those are just going to be phased out. Like
You think so?
I do.
It does feel like it's getting
It
like
does
that.
feel like
They'll
that.
have primary care won't exist anymore, and you'll just like
you can just ask your AI person, like, hey, can you prescribe me
like
Augmentin?
to get the labs and
Yeah. Hey,
and maybe
can
people go
send
to
my
urgent
referral?
cares for their acute needs. But
I think ortho females knowing how to do procedural things and make surgical referrals, it's never going to be replaced.
Yeah.
So,
That's a good point.
Yeah.
I didn't think about the AI part.
Yeah. Somebody asked me the other day, like, do you ever think your job could get replaced by AI? I was like, no. Like, one,
No,
it's
definitely
hands on.
not.
Like, like our job is very hands on.
Yeah.
And I like that about it. But also, like, you can plug into ChatGPT your symptoms that you're experiencing right now and whatever. And you can probably get a very good idea.
They said it was rhabdo. So.
Yeah, like here we are. Yeah. And like he'll give a good differential and everything, but there's just nothing that, I mean, physical exam is like a huge key part of like this
What we do.
specialty. Yeah.
And have you
And
ever put an
procedures.
X-ray into ChatGPT?
No, have you?
Oh yeah, just funny. It's just funny. Because
Wait,
like,
I didn't even know
it's
you can.
definitely broken.
You can't. Yeah, you can't.
And I'll be like, show me what you're seeing. And it will take my x-ray of a perfectly fine like femur and then it breaks it at the femoral head and be like,
What?
the fracture is here.
Wait, I made it. That's hilarious. I did not. I'm gonna have to try that.
It's very funny.
Ironically, so like ChatGPT helps me make a lot of the like cover art for the podcast. And last week I was like, give me like the skeleton hand doing XYZ, and he only gave it 4 fingers. I was like, please add a 5th finger, and he spit me out the same thing. And I was like, no, I need an extra finger.
They're like, the thumb's not a finger.
Yeah, like,
Hannah.
Okay, come on. You have everything you need right here. Stop. Yeah. So he can do some stuff, not everything. Well,
good. Well, yeah. Thank you, April, for coming on and talking with us today.
delightful.
I've learned some things.
I learned a lot of things.
I've learned a lot of things today.
I do wish I would have had somebody to paint on. That's my biggest regret.
That you didn't have body painting
Yeah.
at your program.
Yeah.
Well, you know what?
Is this where I dropped the F-bomb here? Is this...
Oh my God, you forgot to the whole time.
It didn't serve you well.
There was no appropriate point for it.
Well, we'll have to have you back then.
Yeah. It'll have to be an
explicit.
explicit podcast about some heated topic. I'm sure we have plenty of those out there. And you know what? I can body paint during that one.
Oh.
All right. I'm leaving.
Please don't.
Thanks for tuning in to Joint Effort PAs. If you enjoyed this episode, be sure to subscribe, leave a review, and share it with a fellow PA or med-minded friend. You can also follow us on Instagram at Joint Effort PAs for updates and extra content. See you next time.